Hello, welcome to MamaTalks. Today we are talking with Dr. Annie Tubman. She is both a family medicine doctor as well as a lactation consultant. And our topic today is what pregnant folks need to know about breastfeeding. So Dr. Annie, do you want to say a word about what got you interested in doing lactation consulting when you were already a physician?
In terms of lactation, what I think got me interested is often when people have babies, there's a focus a lot on pregnancy. And I think we sometimes neglect how stuff about lactation comes up during pregnancy. It comes up in the postpartum period, in the interpregnancy interval. So it really is connected to a lot of different phases and not just, right after you deliver and start to breastfeed. On a personal level, my mom, I was raised by an OB nurse who is also a lactation consultant. So I guess you could say it's in my blood. And so my mom likes to call herself the breast whisperer.
The breast whisperer, I love that. That is so cool. Well, I have so many questions for you. Basically, I had a really hard time breastfeeding my newborn, but there were so many things about newborn breastfeeding that I wish people had told me about before I had my baby. So those are the questions I was hoping to cover with you today. So one of the first questions I have is, what does newborn breastfeeding look like? How often do they typically feed, and how much do they drink volume-wise with each feed?
And I would say first to anybody listening that breastfeeding success can look very different for different people. Newborns feed very often. I would say right at the beginning, they're feeding every 1 to 3 hours. I would say each baby is different. Each pregnancy is different. And so I think what I always say is it's hard to know. It's great to say, yes, I want to breastfeed and I am a full breastfeeding supporter. But I also say a fed baby is a happy baby. And I think people don't realize that it's very complicated in terms of the physiology of breastfeeding, and that it sometimes can take a lot of work.
When I think about feeding somebody, I think about like kind of large volumes, but the size of a newborn stomach is actually really tiny, right? Can you speak to like how much they're actually feeding with each feed?
Yeah, when people first, when they have a newborn, I always say, I love the graphic that you put up. And I think you compared the day one. I always use an almond, but I love a cherry a little bit better. That it's so tiny. And that, I think there's a lot of anxiety of like, oh, will I produce enough milk? When will my milk come in? And some women, one of you mentioned that you were 31 weeks. Some people in their third trimester are starting to produce colostrum and some aren't. And it's normal if you are, and it's also normal if you aren't. And colostrum is, again, that kind of pre-milk, right? That comes in, it comes in early, later in pregnancy and right in the newborn period before your milk comes in. And that different milks have different fat contents. And when I learned about this, it was so amazing to me that the different amounts of fat and protein in your milk is really perfectly designed for babies at different stages. So for those first couple days, they don't need that much to fill their bellies. And then even by day 1 week, they are, I think by 1 week, we put an apricot or an egg. So they're a lot bigger, that they'll need a lot more milk at that point.
As someone who's a first-time mom, like how can you tell if your milk has come in? Are there signs you're looking for?
Yes, totally. And I would say commonly, if you're a first-time mom, milk typically comes in on day 3. And that is, again, that's a very generalization. So sometimes it might come in, day 2, day 4, depending on what's going on. I have 3 kids myself. And I remember after my first baby, on day 3, I woke up and I literally felt like my breasts were footballs. And they were extremely hard and painful. I felt a lot of pressure. It was really actually one of the more overwhelming moments for me breastfeeding is, what do I do with all this milk? And it's interesting because your baby has been used to very small amounts of milk in those first couple days. And when your milk comes in, I would say it goes from like a trickle to like a hose. So then we start talking about how to help let down so the baby's not as overwhelmed, self-expression. And when I say that, and this is in general great the first couple days for parents, is sometimes it's hard to get baby to latch on. And so what can be helpful is to have your partner, or if you're working with a lactation consultant, to help you for self-expression, to help that milk let down. Some of that is actually pressing on either towards your nipple or towards your axle or towards your armpit, to help that let down. More importantly is also making sure where you're at breastfeeding that you are comfortable. So always in breastfeeding, I think we're always focused on how the baby is doing and getting the baby nutrients, but it's always a dyad relationship. There's always you and the baby. And I think we often neglect ourselves in that equation, and that actually getting in a comfortable position, making sure you're hydrated, getting a lot of, I would say, tons of pillows or a breastfeeding support system, getting the baby in a good position, and then starting to work on letdown and trying to get the baby latched on. You will see in, whether it's in the media or people who have been breastfeeding for a long time, they'll say, oh, they'll just put the baby on the breast. And it's not so intuitive right away. And so I think trying to think of yourself in that equation can be really helpful.
Yeah, I think of breastfeeding as kind of similar to riding a bike. Like the 100th time you ride a bike, it's completely effortless. You don't have to think about it. But the first time you ride a bike, it's actually can be really challenging. And that's kind of how breastfeeding is, because you're figuring it out.
I'm a really big proponent of kind of the laid back method on breastfeeding. And so you can find that there's some great YouTube videos. And that will help you being in a comfortable position, will help your oxytocin, that hormone that helps that breast milk come down. That'll help. Because if you're in pain and uncomfortable, and there's a lot of discomfort in that period after birth, that's going to interfere with your milk production. And so thinking about that and having your partner help with that can be really helpful.
Yeah, the laid back breastfeeding where you bring the baby to you instead of you leaning toward the baby, that saved my neck. Like my neck was going crazy spasms until I started doing that. That's such a good point. I wanted to ask you about breastfeeding jaundice. Since the first 2 days, typically people aren't producing a ton of volume of milk. Do babies have a higher risk of getting dehydrated and getting jaundice if they are exclusively breastfed?
That's a great question. And I think there's so much information out there, it can be kind of overwhelming. I will say most babies get a little bit jaundiced, right? And when we say jaundice, what that means when you have your baby is around day 2 to 4, they start looking a little bit yellow. If you have a hospital birth, they're really calculating how much weight. All babies lose a little bit of their weight. So it kind of depends on what's going on overall clinically with your baby. What the breast milk, in terms of breast milk jaundice or different kinds of jaundice, there's levels that we track that. And actually, the more you feed, the better. And the more baby poops, the more baby gets rid of it. I always say it's kind of like how the baby's physiological system gets used to from an intrauterine environment to an extrauterine environment to get used to where you're at. And so that's something that we do track, but the best thing that we can all do is just more frequent feeding. And again, one of your other questions touched upon supplementation. And so sometimes when babies are more jaundiced, then we do recommend supplementation. So in general, most of the time we're trying to push mostly breastfeeding. If there's other clinical issues going on and you're in a hospital, sometimes they actually have donor milk if there's a clinical reason why your baby needs supplementation.
So how can you tell if your baby is getting enough breast milk? Are there things that they should be tracking, like how many diapers per day or weight gain, something just to let you know you're on the right track?
We do a lot of diaper, counting the number of wet diapers the first few days. And I also think it's, it can be overwhelming. Oh my gosh, did my baby feed every 2 hours, every 4 hours? The other thing that's really helpful is if you have a breast pump, and breast pumps are covered by the Affordable Care Act, is to actually use a breast pump to help quantify how much milk you're producing. And so that can be really helpful. Remember, don't get discouraged if you're only producing half an ounce. That's great. And sometimes I always say pumping in addition to feeding can be really helpful to help get your supply up and to help if you have cracked or sore nipples right after birth.
Do you have a rough guideline for newborn weight gain and what to kind of be aiming for with that? Because I know they lose weight initially, right? Because of the dehydration and stuff, and then they gain weight.
All babies lose a little bit of weight when they're born. The biggest number is we as physicians and providers, we want babies to get up back to their birth weight by 2 weeks. So for those of you out there who are like, oh my gosh, my baby lost some weight, that is totally normal. There are often, so we watch that closely, and the peak weight loss is often between 4 to 7 days, and then it starts going back up. And so our goal is at 2 weeks to be at or around their birth weight. And again, I always say each person's situation is differently. So if you have a very small baby, they often lose more weight. And if you have a very big baby, they often lose more weight.
Thank you. Then my next question is, since this is all so new to people, like I remember as my baby was older, I could always tell instinctively if she had a good latch or not. But as a new breastfeeding parent, like what are the signs you're looking for that your baby is actually latching well?
The first indication I always watch for is pain. So really looking at if every time you breastfeed, it is very painful, something is going on. It should not be that painful. It can be painful right at the beginning. Very common. There's a lot of common things of how babies latching, and sorry, I don't have good graphics, but we want a newborn to come from underneath your breast and to have a good latch. So it's not just a shallow latch right at the nipple. So there's actually tips and tricks and something that you can involve your partner with in making sure the baby kind of open up that mouth to go over the nipple. So they're not just like sucking on the nipple, but actually have some of the other part of your breast, the areola, in their mouth. There are things that we also watch as lactation consultants to see if baby's swallowing. And so I think the biggest thing is those first couple days are really crucial in being able to get into a nurse or a birth specialist who has some lactation experience can help.
It sounds like some of the things to watch out for, like not having excessive pain, and then also the mouth of the baby should be not just on the tip of the nipple, but really cover the whole areola. And then what I saw you doing is like neck extension. So when the baby's neck is extended as opposed to flexed like this, they'll get a deeper latch. So if you like position them so that their neck is extended rather than crunched down, that can help. And then another thing that I found helpful, like I don't know if you would agree, is like a certain rhythm. So they'll often do like a slurp, 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 swallow, slurp, slurp. So they're building up that rhythm of like maybe every 3 or 4 to a swallow. And that's how you can tell that they're getting that milk flow.
And as a mom, you can hear them swallow, like that slurping. It's actually really audible. It's a crazy sound that you can actually hear that once you start, and I always say, if you go on and then it's like something doesn't feel right, you just reposition the baby and to try to get that deeper latch. And again, when you're comfortable, you don't want to be, I think a lot of times we're hunched over and our necks are hurting and our shoulders are hurting. So making sure that you're comfortable, and that will actually help your milk let down when you're not in pain and discomfort.
And then speaking of latch issues, so one topic that's really hot that I don't know if it's overrepresented or not, but I see this a lot in moms groups, and then this came up for my own baby, is the issue of tongue tie. So how common is tongue tie, and like how often is it enough of a problem that you need to get either laser or the scissors surgery to repair that?
I'm so glad you brought that up. I feel like tongue tie is one of those areas in medicine that for a long time it was kind of under talked about. And then I think now we're always talking about it. And so is it like every baby have tongue tie? Where do you stand on that? So in terms of what tongue, if you look at your own mouth, so on our mouth, the top part of your lip, that's where an anterior tongue tie would be. And a posterior tongue tie is underneath your tongue, right? When a baby has really significant tongue tie, they can't even push out their tongue from their mouth. It's like they can't fully extrude their tongue outside of their mouth. And clinically significant tongue tie really can impair feeding and cause some speech issues with babies. But it's a lot, oftentimes we can't get those babies to latch well, and there's a lot of persistent pain. That being said, not every baby who has tongue tie has problems breastfeeding. So you might be able to successfully breastfeed, and somebody might say, oh, it looks like your baby has tongue tie. And there's not necessarily something that has to get taken care of. I will say it's something that we do try to look for in all babies after they're born, to kind of look at their mouth, examine their mouth, examine how they're breastfeeding. And then if it's clinically significant and really affecting breastfeeding, there is procedures to release that tongue tie. And there are a lot of specialists within the Portland area who do that regularly if that does become an issue. So I guess I would say that it's something to be aware of, but not every tongue tie needs to be repaired.
Do you find in your practice that a posterior tongue tie can also affect latch when breastfeeding? Because I know the anterior one definitely can, but the posterior one is kind of controversial if it affects it or not.
Yeah, I mean, that's a great question, because there's like 4 different grades of posterior tongue tie, and there's some sub variants as well. So when I say that, it's just a lot of medical speak for that. There can be a lot of different types of tongue tie. The types of tongue tie that really do affect breastfeeding is if the baby can't move their tongue at all during feeding, that is something that is going to make latch and getting the milk in very difficult for the baby. And that would be a very severe posterior tongue tie. When they're more mild, sometimes those babies breastfeed fine. So I would really say it. And then the other part of tongue tie is it also depends on the baby's mouth. So some babies, if they're born at an earlier gestational age at 36 or 37 weeks, they have smaller mouths and their cheek muscles aren't as developed. So for a baby like that, if they have that and a tongue tie, there might be multiple issues going on.
Like any common saboteurs you find that are often issues that come up in your practice that you just want to let people be aware of?
There's a lot of expectation if you're somebody who wants to breastfeed that you have to have it done a certain way. And it has to be, you have to breastfeed for 6 months exclusively, and you have to breastfeed for a year, and it has to be easy breastfeeding. And I always say that what that means is different for everyone. So I have parents who have had a real struggle breastfeeding and end up doing, 50% breastfeeding and 50% formula supplementation. And I would still call that a formula success, a breastfeeding success, that it's something that's awesome. And that every bit of breastfeeding that you do is wonderful. And sometimes it's more just for comfort. And again, how long we breastfeed, what we do, what each of us have, if you're returning to work, if you're planning to stay at home, each of those factors play into that. So I guess I would go into it with an open mind and know that, it is often more challenging and complicated, and it hits us right after we've given birth, when we're exhausted and suddenly we're like, how do I feed this baby? So there's a lot of different factors, and just to be gentle on yourself.
Yes, absolutely. Thank you so much for bringing that up, because I absolutely agree with you that breastfeeding success looks differently for different people. So thank you for normalizing that some people may use formula and some people may not. That does not mean that you're not succeeding at breastfeeding.
I have a great little question here. What happens during those first few days before milk comes in? Is colostrum coming in during that time? Or supplementation until it comes in? I've heard colostrum can be painful. Any tips for easing discomfort? Great question. Again, after you give birth, and again, it's a little bit different if it's a vaginal birth or a cesarean. Both of those, there is colostrum. The cesarean, it just takes a little while for that natural physiologic cycle. It's from your breast to your brain for the oxytocin to be let down. And so we all do have oxytocin after giving birth, but for some people, it can take a little bit longer to develop. There are some specific disorders that are connected to when you have let down that is actually fairly unusual. So if that is, I always say when you are having let down, when you're about to feed your baby, trying to have a calming ritual, which is easier said than done with a newborn, but being in a comfortable space, having, a cup of tea or something, make sure you're feeling relaxed, have your partner help you to get in a relaxed position. Music can help getting into that if there is pain with colostrum. Usually during those first few days, there's pain in your nipple area with baby latching on. And the actual pain from letdown is something that can be painful, but is something that usually resolves fairly quickly.
Feel like supplementation is necessary in the first couple of days before the milk letdown really comes on?
Not usually. No, I would say if it's a normal, healthy, full-term baby and there's no clinical issues, we don't usually need any supplementation. The incidents where we need supplementation is, whether there's weight issues or there were infection issues during labor or delivery, with anemia, there's a lot of blood loss during delivery. Those are times where there's a clinical need for supplementation, but most of the time supplementation is not needed. And what the word supplementation also means is different. So for some people, it might just mean that you hand express or with a pump express that, and then help use a feeding system to supplement your baby. So it doesn't necessarily mean donor milk or formula.
I just thought of another question. Something that comes up really commonly when breastfeeding newborns is plugged milk ducts and mastitis. Those are super common issues. Are there any ways that you found to help prevent plugged milk ducts and mastitis?
So I'm so glad you asked that. I called up my mom this morning. I'm like, Mom, I'm giving a breastfeeding talk. Do you have any tips? And she was like, have people buy some cabbage. This is like that. So cabbage can help with milk letdown, and actually also help with engorgement. It's a little weird to be walking around with cabbage on your breast, but it can help. The other thing that is often a lot easier to use is the either heat packs or ice packs, those packs that have rice in it that you can either heat up or put in the freezer. And those are multi-use to help with clog. Heat and ice are amazing. Heat can really help with clogged milk ducts. And when you have either developing mastitis or just engorgement, ice can be really helpful to calm that down.
Ice and lettuce leaves, or cabbage leaves.
Cabbage leaves. If you can deal with the cabbage smell on your body. And then I guess for mastitis, babies normally have a preference for one side, and you might notice that suddenly your left breast is twice the size of what your right breast is, and baby always has a preference to that side. So remember to try to feed on both sides. And then if you are neglecting one side, which is super common, say one side your nipple's really sore, one side it isn't, that's when we have mastitis develop, because that milk is still being developed. So it's just sitting there, and that's when the infection, that inflammation can happen. And so mastitis is something we really try to watch out for. So trying to feed on both sides always is really helpful. I always say a nipple shield, though they're less than $10. They have them in hospitals and birthing centers, and it's a little plastic flexible cup that fits over your nipple, can be really helpful if there is some nipple damage. We try not to use it unless we need it, but it can really help to be able to feed on both sides if one side is very painful. Somebody brought up a last minute question of hands-free pumps. So first of all, I know from when I had my babies, I think that was what was offered as the Medela. There's a lot of other brands out there. My biggest advice, if you are going to know you're going to either go back to work or need to pump for whatever reason, is to buy or make a pumping bra that saved my hands and my shoulders from carpal tunnel. And that's basically a bra that goes over the what latches onto your breast. So you really do feel like a cow when you're pumping, but try to make it so your hands free. Really saved my life. Again, I was telling Dr. Lang before we started this that I had all of my babies in my medical training. So I would often be doing notes while I was pumping. And so I think being able to be hands-free, there's some great new pumps out there, the Spectra, there's some great options. In terms of a cheap pump that's great if you're on the go, especially if there are some breastfeeding issues, those pumps that you hand pump are exhausting for your hands and really hard on your hands, but can be really helpful to self-express if needed.
Just if you check out our other entry on breastfeeding and returning to work, that goes over the different kinds of pumps a lot more. So even with the hands-free with the bra, the ones that aren't the super compact lightweight ones are going to be better at extracting milk. The really compact lightweight ones that you can just wear your normal clothes and even walk around, that's like the LV and the Willow. Those are not as efficient at extracting milk like the Spectra that Dr. Tubman just mentioned. So keep that in mind. I think for the early period, probably having the more like the stronger pump is going to be more important than you being able to walk around without people being able to tell that you're pumping. So yeah, check out that entry too, and that will get into the pumps.
And I guess just a final point on that, and this is something I didn't know for a long time, is that, you know, all of our nipples are created differently. And so actually the nipple cup that is used for pumps, so there's different sizes, it's called a flange. And so if you say have a flat nipple or an inverted nipple or a very large nipple, you will actually need to have a different size. Your child is very cute, by the way.
Thank you. Oh, and yeah, the Haka, that's the brand name for the one that you mentioned, the hand pump. That is so helpful for so many reasons. Like I wouldn't try to pump all the milk with that because, you know, your hand is going to cramp up and die. But what I would do, I would just keep it in my purse. And then whenever I was out, if I felt my breast getting engorged to the point that it was painful, I would just do that a few times just to relieve that pressure. And then the other thing you can use for that that's really helpful is like while your baby's nursing on this side, you can stick that on this side and be collecting all the kind of drainage that would normally just be wasted. Thank you so much, Dr. Annie Tubman with Northwest Primary Care, who's a family medicine doctor, as well as a lactation consultant. If people wanted to come see you in clinic or find you, how could they reach you?
So I work at Northwest Primary Care. We're in Oregon City. We also have clinics in Milwaukee and Sellwood. And again, feel free to also shoot questions my way about pregnancy or lactation for breastfeeding people. Thank you so much, Dr. Lang. I really appreciate it.
Thank you. I'm so grateful you came on. I learned a ton from you. Thank you so much for being here.
And thank you, our participants, and for anybody viewing this. I really appreciate all of you. Thank you very much.